This meeting is being recorded.
A very warm good evening to one and all. Welcome back to the today's session. Today we have our guest speaker, Dr. Aparna ma'am. So today's topic will be regarding the effective strategies for academic success. We welcome you, ma'am. We welcome you all the participants. Over to you, Sambhashini.
Hello.
Yes, Sambhashini, you are audible. Yes.
Okay, ma'am. Okay, so very good evening, esteemed guests, and welcome to Homeovision 2050 webinar series organized by the All India Homeopathic Students and Youth Association, AIHSAYA. My name is Sambhashini Gore, and I will be your anchor for today's session. It is our pleasure to introduce Dr. Aparna S Kunnummel, Assistant Professor at the Department of Repertory, Government Homeopathic Medical College, Trivandrum, Kerala. Dr. Aparna brings a wealth of knowledge and experience in homeopathy, and we are honored to have her share her expertise with us today. This webinar's titled Effective Study Strategies for Academic Success will have a dedicated question and answer sessions at the end. So, tie your chairs and stick to it because this is going to be a very productive session today where you can pose doubts to Dr. Aparna. We encourage all participants to engage with us on social platforms like WhatsApp, Insta, Facebook, and YouTube also. Without further ado, I invite Dr. Aparna to commence her presentation. Dr. Aparna, please proceed.
Thank you. So good evening all. So as far as my knowledge, students belonging to UG and PG have joined for the webinar, right? UG and PG students are there for the webinar.
Yes, ma'am.
Okay. Our topic of discussion today is effective study strategies for academic success. But mainly I'll focus on how to prepare for competitive exams. Okay. So shall we start? Shall I proceed now?
Yes, ma'am. Session is all yours, ma'am.
Okay. Okay, so for any type of preparation, so the most common exams the homeopathic students face is one is mostly they will be aiming for after graduation, they will be aiming for post graduation, and after that some will be focusing on the clinical practice, and some will be focusing on UPSC and other PSC exams mostly. So the thing is that for all the competitive exams, the pattern is entirely different. Okay, we have 12 subjects in homeopathy, and the questions asked in the style of questions asked in PSC is entirely different from those asked in UPSC question paper. So the first thing is we have to know the question pattern. Okay, the question pattern, what they are going to ask. We should have an idea regarding that. Then only we can start our preparation. Okay, I will come into detail into that one by one. So we know that competition. Okay, we all compete, but not all of us will come to that end of success. Okay, it depends from person to person how hard work they put in how hard work they put in their preparation. So it depends on person to person's hard work only. Okay, so you just look at this graph, start, think, analysis, planning, try, do again, keep on doing. Okay, so most of the students, as far as to my knowledge, they always start, they always think, they always do the analysis, they always do the planning, and they try and they do it. Okay, but they don't do it again, and they did not keep on doing. That is why they're not coming to that stage of success. Okay, so most of the students, even today, we have a periodic assessment. We have the first year examination, UG students exam, their periodic assessment. We have a small viva of 10 marks. Okay, so the most of the students, what they are telling us that, ma'am, we have read already the portions, but I can't remember. Most of the students are unable to answer when they sit in front of us. But why? You know why? because they are not thorough with it. They haven't done the revision. Okay, if you are going to study the definition of repertory today, you need to revise it tomorrow and day after tomorrow. Then only you will be able to answer it before the teacher. So in repertory, if UG students are here, I'm telling you, we need to study the basic things like definition of repertory, definition of repertorization. Then what are the advantages of repertory? What are the limitations of repertory? These are the basic things you are studying in the introductory portion of the repertory. You have to cover all this. So this type of questions can be asked in your viva. So if you are not able to answer this type of basic questions, that means you are not thorough with the subject, or you didn't get the concept of the subject. Okay, I'm talking of repertory because I am the assistant professor in the department of repertory. That's why I'm talking about this particular subject. So doing it again and again, okay, the repeating what you have studied, going on with the revision is very, very important for any exam, not only for competitive exams, for the UG exams also. This is very, very important. Okay. So the first thing is that you have to set a clear goal. Okay, whether what you have to study, when you have to study, you have to set a clear goal. So you have a target. No, you will be having a short-term target and you will be having a long-term target. So manage it accordingly. That is the first thing you have to do. So we know we have a very big syllabus. So what you have to do is you have to break the syllabus into manageable parts. Okay, break the syllabus into manageable parts. That means you have to plan how much time I have to spend for a particular subject. For repertory, how much time I have to spend. Some students may be very good in repertory, some students may be very good in materia medica. Again, it depends on student to student, or varies from student to student. So if you are weak in one subject, you have to spend more time for that particular subject. Okay, so set that clear goal. And you have to track your progress regularly. How will you track your progress? If you are a UG student, you can see when they conduct the formative assessments in your, that means your periodic assessments, how you are scoring and what is your viva marks, what is your theory marks, all will give, you can track your progress through these type of exams. Okay, for those who are preparing for competitive exams, you have to work out the question paper. Just see how many questions. If there are 25 questions you are working out for repertory, just see how many questions you can do. Whether some may be able to do all the 25, some may be able to do 20 questions. So likewise, you can track the progress. Okay. The next is create a study schedule. So always, this is very important. We have to follow a timetable. We have to know next day what I have to study, what I have to do, which subject I have to give more time. So this is very important. A study schedule or a timetable is very, very important. And study it and do the revision. Don't forget to do the revision. Okay, you cannot comprehend in one reading. You may think that, yeah, I have studied so and so, this is very thorough to me. It's not like that, because it is not one subject we are studying. We are studying lot of subjects. We are studying 12 subjects. No, when you're preparing for a competitive examinations, you are studying for the 12 subjects. So you have to recall it when the question comes to you, or when you are doing or working out a question, immediately the answer should come into your mind. Only this is possible if you do at least 3 revisions before your exams, which is very important. Okay. Then next is active learning. Active learning in the sense that is, after you have studied a particular topic, you can summarize it in your own words. Otherwise, you can narrate it or you can discuss it with your friends, like what you have understood from that particular topic. You can discuss it with your friends. That is active learning. Okay. Those who are studying alone, those who are just reading it alone and not discussing it, that is the passive type of learning. But active learning was more easy to memorize, and that will be that will be able to recall it when you discuss it with your friends and study. That those things will be able to, you can recall it very easily. That is active learning. Okay, but some subjects it is better. For example, especially when you study the rubrics of repertory, active learning is very beneficial to you. But some students may not be like or may not be interested in this type of active learning. They want to sit and learn silently. Again, this depends on person to person, but active learning is little more effective. Okay. Then understanding is more important than memorizing. Okay, there are subjects which you have to memorize. For example, in repertory, there are some topics which you need to memorize it. For example, there are a lot of definitions, there are a lot of quotings by different pioneers. Then when it comes to materia medica, when it comes to some aphorism, you need to by heart some aphorism. No, aphorism number 9 of the vital force. Then all such aphorisms, susceptibility. Then many things. There are some topics which you need to by heart it or memorize it. Okay. Other than that, there are some topics like practice of medicine, then physiology, pathology, surgery, all these things you have to understand it. You have to understand the concept and study. Okay, so understanding is more important than memorizing in some subjects, but in some other subjects we have no other choice rather than just by hearting. Okay. The next is regular revision. I have already mentioned about the revision, which is very important. Make 3 revisions before you appear for an exam. Not only competitive exams, but the UG students who are present here, you have to read it again and again before going to appear your university exam. Do the revision regularly. Okay, do at least 3 times of revision. Then practice papers. Yes, that is very important. Okay, for UG students, you can take the university question papers of 3 to 4 years or at least 5 years back, and you work out that. Mostly, this will be asked. Okay, there will be repetition, chances of repetition for the questions asked previously. Even the teachers themselves, we also prepare questions by referring the previous question papers only. We are not creating something new or creating a new questions. Okay, we always refer the previous question paper and make a new question paper. So that is very important. Even the competitive exam preparation also, that is very important. Try doing if you are going to attend exam in 2025, then from 2020 you collect all the question papers, whatever maybe different state PSC have completed UPSC question paper, assistant professor exams. Collect all the question papers in the period of 2020 to 2025, and then you can practice it. Okay. Then stay healthy, which is very important. As you know, we need a healthy mind and a healthy body for whatever we do, especially for for the preparations. This is very important. We have to stay healthy. Our mind and body should be very calm while we are doing something, especially if you are preparing for something, preparing for exams. Try to be stay calm and stay positive. Okay, limit distractions. Okay, so this can happen when most of the students might be staying in hostels. They are away from your parents, and there will be a lot of distractions. But the thing is, we have to overcome all this, right? All the students or all of us are passing through a certain phase of life, and we have nothing to do rather than overcoming it. Okay, so remove all the negative vibes and think that we are all doing this for a good future. Okay, so keep a positive mindset and go forward. Okay, so this is what the basic things you have to do for any student, whether you are a UG student or PG student. These are the things you have to remember before going to prepare an exam. Okay, or as a student, these are the things you have to keep in mind if you want to attain a success. Okay, so let me come to the main topic. So for any type of preparation, what you need is consistency, focus, and smart work. Now, let me tell you that preparing for a competitive exam is entirely different from preparing for a university exam, like the UG students do. Okay, for that we need a smart work. Okay, for preparing a competitive examinations, we need a smart work. Remember that word, smart work. So you will understand when you come to the next slides. It will be clear what I meant by this smart work. Okay, so remember consistency, focus, and smart work. So let me focus more on the competitive examinations. How you have to prepare on competitive examination. Okay, first of all, what you have to do is understand well the question pattern. Understand well the question pattern. See, I'll show 2 question papers. See, these are the pattern of questions asked in UPSC 2020 exam. Organon 18 question, Materia Medica 30 question, repertory 18, pharmacy 11, and the other subjects you can see 73 questions. Okay, see, what are our basic subjects actually? Definitely organon, materia medica, repertory, pharmacy, these are the basic subjects a homeopathic student should understand. And the other thing, yes, that also we need. But still, you have to give more importance what homeopathy is and what are the concepts in it and what are the what our pioneers are mentioned in it, what are the new updations. All this is very important. Okay, so you can see the UPSC pattern. Okay, see materia medica, which is one of the one of the very base of homeopathy. Without materia medica or without the questions from materia medica, you cannot see a question paper. Definitely there will be questions from materia medica. It can be from like Alan Skinner, Boric, and nowadays questions are being asked from Kent's lectures and Nash also. Okay, you can see that the pattern is entirely changing. Okay, every day or every new exams comes with a different pattern of questions. But earlier, I think around 5 years back, when I was writing the exam, I wrote my PG entrance in 2015. At that time, only Allen's keynote and Boric Materia Medica we need to study. I think no questions will be asked from other textbooks of Materia Medica. But it is not like that now. You can see questions from Nash and Ken's lectures even. Okay. So I'll show you another question paper pattern. The PG entrance 2025. See, the UG students, please focus on this. You can see organon 12 question, materia medica 20, repertory 16, pharmacy 9, then medicine, physiopathy 24, gynec and obstetric 11, surgery 5, FMT 2, PSM 9, anatomy 4. Okay, so this was the question pattern in AIA PGT. So that is why I told you in the beginning, the questions asked in UPSC, the pattern is entirely different when it comes to the PG entrance examination. It is entirely different when it comes to a state PSC. Okay. So Kerala PSC will be entirely different from another state PSC, whether it is Assam or other states. Okay. Then next point, never skip the most relevant topics from each subject. So it is very important to know like what you have to study in every subject. I'll just detail you that. See, from materia medica, what you have to focus is Allen's keynote, which is the basic textbooks, the symptoms written in bold, which is very important. The relationship section, most of the students skip that relationship section. Okay, the when it comes to the polycrust remedies, there are many relations written, like sulfur. The what are its complementary? What are the follow well remedies? Even you remember like lycopodium, phosphorus. There are many important points in the relationship section. Okay, then aggravation and amelioration. There are many peculiar aggravation. Not it is aggravation morning, night, afternoon, amelioration lying on abdomen. It's not like that. There are some peculiar modalities in some some remedies. Okay. So that is very important. Time aggravation, we know the lycopodium aggravation, 4 p.m. aggravation. Then provers, we have to know the provers of the remedies, which is very important, especially those proved by Hahnemann. How many remedies were proved by Dr. Hahnemann? Can anyone answer? Anyone answer?
99. 99.
Dr. Hahnemann has proved only 27 remedies. Okay. At the time of Hahnemann, there were 99 medicines. Okay. So this is the thing you are going to make mistakes in MCQ. Okay, so the Master Hahnemann had proved only 27 remedies. At the time of Hahnemann, there were only 99 medicines. Okay, so these are the things students make some confusions. Even I was asking these questions to the first year students, and some of them were telling me the answer like 99. It is not 99, it is 27. Okay, it's just 27 remedies were proved by Dr. Hahnemann. Okay, 99 medicines were only available at the time of Hahnemann. Okay, so these are the things you should focus. Don't make these type of questions. You can easily score your marks by answering this type of question, this type of year. In repertory, you have many years. No, Ken's repertory first edition was published in. Then Ken's repertory, the Indian edition was published in. The 7th edition was published in. How many remedies in TPB? How many remedies in the concordance section of BBCR? How many remedies in the concordance section of relationship of remedies? How many remedies in BBCR? How many sections are there in therapeutic pocket book? What are the number of medicines in Bell's diarrhea? What are the number of medicines in synthetic repertory? How many volumes are there for synthetic repertory. Volume 1 consists of mental general, physical general, and some other options. See, these are some of the basic things you have to know from the repertory. Especially we have, you have to study this certain numbers and years. You can chart this, you can make your own notes and you can just list it down, all this type of minor things. Okay. So coming back, okay, so provers and the common name and the family. Okay, so if you are studying a particular remedy, like say for example, acetic acid, look for who is the prover of acetic acid. Or say for example, lac acid. Who is the prover of lac acid? Can anyone tell me? Lac acid?
Hearing.
Yeah, yes,
Yeah,
very
yes,
good.
very good.
Herring proved lac acid. How many medicines were proved by Dr. Herring? Can anyone answer? Anyone? Dr. Herring proved how many medicines? He had proved 72 medicines. Okay, 72 medicines. Then what is the common name of lac acids? What are the aggravating factors of lac acids? We'll study all this. Then, okay, can anyone tell me the answer? Poison hemlock. Which remedy is called as poison hemlock?
Conium mac,
That's very good. Conium mac. Then water hemlock.
cicuta,
Cicuta, very good. Barberry.
berberis,
Yes, Berberis vulgaris. And another one is there, no? Banbury. Baneberry. Banbury. What is that? Banbury, one of the very prominent remedy for the pain in the wrist joint.
actia spicata.
Yeah, very good, very good. Actia spicata. Okay, so this way you have to learn the common names and all. If you have cracked the entrance, that is very good. All the common names are listed, which is it's very easy for revision. They have grouped it all together, like poison hemlock, water hemlock, barberry, baneberry. All the berries they have listed it together. Okay. Then Boris Materia Medica. Yes, it's impossible to read all the drugs in the Boris Materia Medica, but still you have to learn. The most important thing was the introductory portion. Introductory portion of every drug is important. If any symptom is written in italics, that is important, and also the relationship section. These three things you have to focus from the Boris Materia Medica. Okay, so that's about Materia Medica. Then when it comes to repertory, okay, we have only half hour more, and I have to tell the contents of the 12 subjects also.
Okay.
Not an issue, ma'am. We will extend the time, ma'am, if needed. Yes, ma'am.
Okay, anyway, I'll take it till 8:30. And if it is not complete, we will complete another day.
Okay.
Sure, ma'am.
Okay. So repertory, it's evolution of repertory. Evolution of repertory means, which is the first repertory? Can anyone tell me which is the first repertory?
Fragmented Euribus.
Yes, fragmented Euribus. Can you tell me which in which year that was published?
No, 1805.
1805, very good. So from 1805, then from 1817, from 1805 till date, till 2005, and even we have the Murphy repertory, the latest edition also, which is called as Meta repertory. So from 1805 till the repertory which is available now, we have to know the dates, evolution of repertory. Then introduction of repertory. When it comes to introduction, what you have to learn is like this basic thing. What is the repertory is derived from the Latin word. A rubric is derived from the Latin word. What is the meaning of repertory? What is the meaning of rubric? Such basic things. Then in the introduction also, you can see many quotings of different authors. That is very important. I think in the last AAPGT 2025, a question was asked, which was, I think that was given in your Tiwari textbook. That is a basic textbook you have to learn. Okay, I think all of you have that Essentials of Repertorization by Dr. S.K. Tiwari, which is very important. Okay, that textbook should be thorough, so that I think you can score very good marks. You'll be able to answer all the questions from the repertory if you are thorough with that particular text. Okay, so one of the quoting was by H.A. Robert. Okay, when you read that TPB, Therapeutic Pocketbook, in the introductory portion, there is a quoting which is given by Dr. H.A. Robert. So that was a question asked in PG last year in the 2025 exam. Then when it comes to Kent repertory, TPB, BBCR, you know, these are the basic repertories. Read the introduction. I hope all of you have these 3 repertories with you. Read the introductory portion, which is a very, very good source of MCQs. Okay. Then editions and year. The Kent repertory has 7 editions. Learn the year. First edition 1897, second edition 1908, third edition 1924. Likewise, you have to study. Then TPB, then BBCR, then chapters. Kent repertory has 37 chapters. TPB has 7 sections. BBCR have 53 chapters. You need to study that order. Okay, because in Kent repertory and all, definitely you have to know the order. Mind, then what I go, head, eyes, vision. Sometimes the questions will be asked like, which is the 10th chapter of Kent repertory? Okay, likewise, questions are asked previously, but not seen in nowadays question paper. But earlier, or 6 to 7 years back, when you take any question paper, you can see like that, which is the 10th section of Kent repertory. At least the order of Kent repertory you have to be familiar. Okay, then the different rubrics. Again, the study of rubrics from all these 3 repertory, you cannot by heart all this, which is not possible by anyone. What you have to do is you have to study the contents of the chapter from each repertory. Contents of the chapter of each repertory. For example, if you take the head chapter of Kent repertory, you can see what are the contents in it. Like you can see the different parts of the head, like vertex, occiput, temple, forehead, etc. So if you have a question like ulcers on the occiput, definitely that will be in the head chapter. Yeah, head, ulcers on the occiput. The single remedy is AIHSAYA. Then, for example, another example I can tell you is esophagus. Esophagus comes in which chapter? Throat chapter. Esophagus, all the related rubrics of esophagus is mentioned in the throat chapter. Okay, so you have to study the contents of the chapter first of all. Suppose if a question is asked like, spasms of the esophagus, then think, first of all, you have to think, your esophagus comes in which chapter? It is in the throat chapter. So throat, spasms, esophagus. Okay, then, likewise, you have to know the contents of the different chapters so that you can learn the rubrics easily. Don't think that you can by heart it. There are some rubrics, misplaced rubrics, especially in therapeutic pocketbook, which you need to by heart it. But otherwise, from the Kent repertory and all, it is very easy if you know the contents from the each chapter. Then single remedy is very important. For example, in Kent repertory, affectation, single remedy is stramonium. Benevolence, the single remedy is coffea. Then what else? There is a rubric jiggling, cannabis indica. Then set things on fire. Fire set things on. Hepazal. What is the term used in BBCR for that? Set things on fire. Can anyone answer? Any PG repertory in the batch in our class? Set things on fire. In BBCR repertory, what is represented? What it is given, mentioned? Anyone? It is given as pyromania. Okay, pyromania means desire to set things in fire. The single remedy given is hepazal. Then cross references are very important, especially from Kent repertory. Cross references are very important. Once a question was being asked in Kerala PSC, what is the cross reference for mirth? There is a rubric in Kent called as mirth, M-I-R-T-H, mirth. Can anyone answer? What is the rubric for mirth? What is the cross reference for mirth?
Is it hilarity?
Yes, very good. Hilarity. What's your name? Who answer me that?
Ma'am, alias.
Okay. You are a PG student or UG student?
Ma'am, I'm an internee at Kochi.
Internee at Kochi. Okay. I have completed my graduation from Kochi. Okay. Okay. But, in our college, he said he's from Kochi College, ANSS College. Our teachers used to focus mainly on the single remedy rubrics, cross references. They explain it very well, So that was very useful later, thanks to our teachers actually. Yes, from other repertories, boric. These are the main things you have to focus other than the basic repertory. Boric, Bell's diarrhea, synthesis, synthetic, Murphy, Genry repertory, nerve repertory, H.A. Roberts, sensation acid, symptom register. Who is the author of symptom register? The author of symptom register? Symptom register. Anyone? I'll give you a clue. Is it HCLN, WALN, or TFLN?
TFLN.
It's TFLN. TFLN. Okay. Symptom register. Then repertory of intermittent fever. That is by WLN. Repertory of fever. That is by HCLN. Okay. So there are actually three. Not three LN. There are actually four LNs are there. One is HCLN, WALN, TFLN. Then one more LN is there. Contributed to organon. You know? Can you answer me? Anyone? JHLN. Okay, JHLN. Okay, so don't confuse with these names and all. So from all this repertory, what you have to learn is either year of publication. Then some repertory might have different editions. If you take Boric repertory, you will be having 9 editions. So at least study the year of first edition and last edition. Bell's Diary, if you take, it is having 15 edition, but the first edition you have to know 1879. That is the first edition. Then the fourth edition also it's 1897. Okay, then such things you have to memorize it. There is no choice rather than to memorize it. Study at least the first edition and the latest edition here. The number of medicines, gradation is important. Okay, Boric repertory is having 2 gradation. Bell's Diary is having 4 gradation. So remember that. Then when it comes to organon, you have to read the aphorisms very well. Aphorisms and its footnotes are very important. Then there is a small introduction, no? From that also questions can be asked. Okay, so if you take the AIA PGT question paper, the latest one, 2025 question, there are questions from introduction also. I have checked it recently, and you can see the questions from the introductory portion also. Life history of Hahnemann is very important, and also the works of Master Hahnemann and other homeopaths, especially Kent, Dr. Bonninghausen, Dr. Boger, and also Hurry. Just focus on their works. What are their contributions to the homeopathy? Then when it comes to the philosophy part, there are no question paper without this question, Kent's 12 observation. Whether it is a PG entrance or UPSC or Kerala PSC, there will be a question from this Kent's 12 observation. Okay. Then obstacles to cure, that is very important topic. Susceptibility, you know, susceptibility have many influencing factors. That is very important. Okay, so focus on mainly on this. When it comes to pharmacy, pharmacopoeias, you can see the study the different dates, the number of monographs, then the source of drugs, then the different classes. You have different classes, no? So the method of preparation, the different scales, prescription, the parts used in different plants, and the measurements. So you have the new method of preparation of drugs and the old method. In the new method itself, you have 7 classes, right? So what are the drugs coming under class 1? What are the drugs coming under class 2, 3, 4? So you have to be thorough with that. And actually pharmacy, you can easily, you don't have to spend much time on that. There are only limited topics and you can easily cover that. Yes, practice of medicine, which you have to spend time on this particular subject. You have different systems. CVS is there, gastrointestinal system, respiratory system, endocrinology, skin, central nervous system, excretory system, rheumatology. Okay, so these are the main things you have to focus on. But I have not mentioned pediatrics here. But when I saw the question paper of PG entrance 2025, there was a question from pediatrics also. Okay. When it comes to cardiovascular system, give importance to different types of murmurs, heart block, angina pectoris, myocardial infarction, especially the investigation section of MI. That is very important. Rheumatic fever, the criteria, no? The diagnostic criteria is very important. Then mitral stenosis, mitral regurgitation, aortic stenosis, aortic regurgitation. There are different signs, no? In this type of mitral stenosis, mitral regurgitation, all those valvular diseases and all. You can see different types of signs and symptoms are also, peculiar symptoms are there. So study all those. What are the ECG changes? That is very important. Then congenital heart disease, very important, especially PDA, very important. Then when it comes to GIT, peptic ulcer, IBS, IBD, tropical sprue, Whipple's disease, celiac sprue, CS, stomach, pancreatitis. When you study the practice of medicine part, most of them focus on the symptoms, right? Most of the students, I think, they focus on the symptomatology, the pathology and all. They mostly skip the investigation part. That is very important. Okay, you get questions from which is the gold standard of investigation for eclampsia cardia, which is the gold standard investigation of AIHSAYA. So that investigation part is very important. Also study the normal values. What is the normal value of sodium, normal value of potassium, normal value of C-reactive protein. Study all the normal values, normal level of creatine, urea, uric acid, very important. Even if you go for an interview, these are some of the basic things they can ask. Then respiratory system, COPD, bronchial asthma, CA lung, tuberculosis, bronchiectasis, pneumonia, pneumothorax, cystic fibrosis, sarcoidosis. These are the main topics you should cover. Endocrinology, hyperprolactinemia, diabetes insipidus, diabetes mellitus, goiter, thyroid, pheochromocytoma, multiple endocrine neoplasia. So diabetes and all, there are a lot of MCQs, chance of lot of MCQs, especially its complication part and all, which is the nerve affected, the diabetic foot, diabetic gangrene, all those portions are very important. Thyroid also, there are especially the thyroid portion comes under surgery also, right? So which is the most common CA affecting the thyroid. Which is the most CA to get metastasis. So likewise, questions give focus on such questions more. If you practice, when you take the question papers of previous years, you will get an idea. I'm just telling those questions which come to my memory. Then skin, the basic, first of all, learn the layers of the skin. Psoriasis, very important. You have many signs in psoriasis, no? Candle sign, Auspitz sign. Then when it comes to the X-ray, there is a deformity, penicillin cup deformity. All those are very important. Leprosy also. There are different types of leprosy. So each type is entirely different. So focus on that. Vitiligo, eczema is very important. In eczema also, I think there are some signs. Pityriasis, lichen planus, then hypopigmentation and hyperpigmentation disorders. Then when it comes to CNS headache, different types of headaches are there, you can read this migraine, cluster headache, all those, just read it. Not much important, but you can just read it off. Headache, different types of headache. Epilepsy is important. Parkinson's disease, again, very important. Then multiple sclerosis, meningitis, Alzheimer's, motor neuron diseases, myasthenia gravis. See, don't skip these topics. Okay, even if you skip headache, it's okay. But the other topics are very, 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 very important. Excretory system, nephritic syndrome, nephrotic syndrome, renal failure, both acute and chronic renal failure. Then glomerulonephritis, hematuria, and cast, different types of cast. RBC cast is seen in which condition? WBC cast is seen in which condition? So all these are important. Rheumatology, all these topics, OA, gout, RA, psoriatic arthritis, reactive arthritis, ankylosing spondylitis. SLE is a very vast topic, no? SLE is very important because it is having other many systemic manifestations. Systemic sclerosis, you have different signs in that, no? The systemic sclerosis, there's a sign, I think, called as cucumber sign and all. Vasculitis, Takayasu arteritis, PAN, Goodpaster syndrome, HSP. HSP is very important. So cover all these topics. When it comes to physiology and biochemistry, all the systems which I have mentioned is very important. You can link this, the physiology and the PM part. So that will be much more easy. Then focus on blood. There is a blood. In blood, I think you focus on different types of cells, RBC, WBC. What are the conditions that result in the raising of RBC, WBC, hemoglobin, all those things. Then hormones, different types of hormones, enzymes, then transport across the cell membrane, amino acids, that is important. Some metabolic disorders are there, no? Phenylketonuria, alkaptonuria, and just go through that things. Also vitamin, no? The vitamins you learn in community medicine also, that topic comes. Different types of vitamins, what are the sources of vitamin, and the deficiency of one vitamin result in what all type of diseases. Study all those things. When it comes to surgery, burns, wound healing, arterial disorders, venous diseases, piles, fissure, fistula, boils, carbuncle, erysipelas, cellulitis, study the bacteria involved in this condition. Then breast is very important. The different quadrants, which quadrant is most easily affected, what are the, is there any chance of metastasis to other areas, which type of CA breast is having the worst prognosis, such type of things. Adrenal gland, thyroid, oral cavity, renal stones and gallstones. That is very important. Hernia, different types of hernia, signs of appendicitis. And surgery, you get many triad, no? Like Beck's triad. There are many triads. I couldn't recollect all. Just go through that. Then when it comes to OBG, in gynecology, the first thing you have to learn the anatomy of the female genital tract, menstrual disorders, menopause, pelvic inflammatory diseases, endometriosis, adenomyosis, genital TB. See, genital TB is a very important topic. Then carcinoma of the cervix, ovary, uterus, endometrium. Fibroid and PCOD. See, fibroid and PCOD is very, very common in females now. So such type of things, no? Especially I think questions will be asked more those topics or those conditions which we have a scope in homeopathy. I think they are focusing more on such type of questions. We know that PCOD and fibroids can be better managed by homeopathy, and even the menstrual disorders, the menopausal complaints. So such things which are disorders which can be easily managed by homeopathy. Such topics they give more attention when they prepare a question, rather than asking the, even if I mentioned you that from the myocardial infarction, angina pectoris, what they ask is more commonly they ask from the PM part is regarding the investigation only, because as a homeopath we need to diagnose the condition, no? So that is why they are asking on that investigation part, because most of us know the symptoms of MI, angina, we know the symptoms of peptic ulcer or gastric ulcer, but most of the students didn't focus on what we have to do next, or even as a practitioner or a beginner, what the confusion that comes to us, what investigation I should do for this patient. So maybe that is why they are more focusing on such type of questions, I think. Then prolapse and fistula. Then OBG, the physiological changes during pregnancy, antepartum hemorrhage, postpartum hemorrhage, labor, purpurian, abortion, types of abortions are there. Ectopic pregnancy, complications of pregnancy, then placental abnormalities, contraceptive methods, assistive reproductive techniques, not that important, but still read those topics also. One thing I didn't mention here is hydatidine hormone. That is one of the common topic that we see in this OBG, hydatidine hormone. Then when it comes to community medicine, epidemiology, screening of disease, different indicators of health are there, no? So you have to study that. Communicable and non-communicable disease, very, very important. Demography and family planning, environmental health, occupational health, then nutrition, vitamins and their deficiency disorders, you get there. Also, you some of the topics are covered in more than one or two subjects, so it's easy. Statistics, different types of graphs, mean, mode, median. See, I think we when or 5 years back or 10 years back, statistics are not given that importance when it comes to a competitive exam point of view. But now, I think that according to our new syllabus, we are following the new syllabus of NCH, that is competency based dynamic curriculum pattern. So when it comes to that, statistics is a very important topic mentioned by them. Why? Because we know the many research projects or researchers in different topics are going on in homeopathy, and statistics plays a very important role in the research purpose. Maybe that is why they are giving importance. Now, even statistics are included as something main in the community medicine topic. But earlier, this was not a main topic of consideration in the community medicine. What we learn, we have a paper in statistics when it comes to the PG. In PG part 1 examination, we have a paper. First year, we will be having a paper on statistics, only that. But UG students now, they have to learn statistics, the different types of graphs, mean, mode, and median. So you can expect questions from statistics again. In the upcoming examinations, you can expect questions from statistics. FMT, then the FMT also, I think you don't need to spend much time in FMT. Usually 2 or 3 questions are asked. But don't skip the subject, because that 2 or 3 marks is very important in determining the rank. Okay. When I say don't give more importance, it doesn't mean that you don't have to learn the subject. I mean, don't spend more time on this. What you have to spend more time on the subject from where questions are more asked. For example, repertory, practice of medicine, or material medical organ, you have to spend more time, because more than 25 questions are being asked from the subject. Rather than spending time for FMT, there are only 2 questions are asked. Spend more time on the subject where more questions are asked. Okay. Then FMT, identification, postmortem changes, medical rules and ethics, injuries, asphyxial death, hanging, strangulation, suffocation, and all. Different IPC sections. See, IPC section you have to give importance. Even in state PSA also, especially the IPC section for rape, then homicidal death. Such questions are commonly asked. So give importance to this IPC sections. Then Indian legal system, dying deposition and dying declaration. Understand the difference between that two. Then toxicology. Okay, at least focus on this topics. Okay, don't spend too much of days for forensic medicine. Remember, less than 5 questions are asked, so spend only that much time on that subject. Anatomy also, but it varies. No, sometimes anatomy more than 5 questions are asked in some question papers, but less than 5 in some other. But again, there are more topics to cover in anatomy. Brachial plexus. From when it comes to upper limb, focus on brachial plexus, cubital fossa, carpal tunnel syndrome, anatomical snuff box, carpal bond. The origin and attachment are some important muscles. Go for the, this is a very vast subject. Anatomy, we have 3 volumes, right? So it's not possible to learn all these 3 volumes for one competitive exam, because we have to spend time on the other subjects also. So what you can do is understand the important topics from that, and just see the question papers and see from which topic the questions are being asked in anatomy. Okay, I have referred many question papers, and I think these are the topics, most common topics from which the questions are coming. Flexor retinaculum, extensor retinaculum, lumbricals. Lumbricals, I think the nerve supply of that lumbricals was asked. Introshape, then lower limb, femoral triangle, femoral canal, adductor canal, tarsal bonds, compartments of thighs and leg, popliteal fossa. Then thorax, mediastinum and structures, supply of heart supply, ribs, lungs, aorta, very important. Head and neck, the triangles of the neck and the cranial nerves are very important. Okay, at least try to cover this much topics. And also, if you have time in the sense, if you start earlier your studies, not in the borderline, if you start early your preparation, you will be able to cover this topics also. Different types of epithelium, joints, cartilages, ossification of bone, embryology, spinal cord, spinal nerve, fractures, skull, facial muscles, prostate. Prostate, like I think CA prostate is very important. You have to learn that. CA prostate, spermatic cord, ligaments of uterus and supports of uterus. That is also very important. Okay, so we know that 1 mark is very important for us, because that 1 mark determines our rank. So don't think that from FMT 2 questions will be asked. I let that mark. I am not thinking about the 2 marks. Don't go to that mindset. That 2 mark is important for you. What I'm trying to convey you is that don't spend too much of time for forensic medicine or anatomy, because don't keep on learning anatomy, the 3 volumes of textbooks, because you have to cover the other subjects also. Okay, so keep a balance or try to understand which subject you have to concentrate on. Okay, when it comes to the books to refer, some of will be familiar with some of the textbooks which I am mentioning now. Success 3 volume, then see Success 3 volumes. That I think first volume is about the homeopathic subjects. Then we have another book, Success by B. Ram Gopal. That one doesn't cover any homeopathic subjects. Only the allied subjects it covers. Success by B. Ram Gopal. That is a very good book. Even I prepared my PG entrance with that textbook, Success by B. Ram Gopal. That was in 2015. Sorry, 2016. 2016. Yeah. So, but now the latest edition of Success is there with many updated additions. That is a good suggestion from my part. Then Rome's. I have these two textbooks, Rome's and Success, with me when I was doing my preparation. Rome's also for allied subject. That is a very more elaborate. Okay, Success is not that elaborate at that time. I don't know about the latest edition, how much elaborate it is. But ROMS was very elaborate at that time, and it covers almost all the topics. Then PG Plus is another one book. Then Modit Kanna, that is for practice of medicine. Modit Kanna, only PM subject is there. You can questions and answers are there for in Modit Kanna. Both the Q&A answer is given in detailed explanation. I think the PDF is available sometimes in Telegram. Crack the entrance for Materia Medica. That is the best book I recommend if you want to study Materia Medica thoroughly. Then for homeopathic subjects, Janarath, that also PDF is available. Janarath. Then Triple A, then Kaizen, Turning Point, VK Chauhan, New Heights. New Heights, there are 2 volumes. This is the latest book, I think. Some of my friends mentioned about this book to me. So this is also having Q&A. Okay, then Realm 3 volumes. Actually, this is my own compilation, conceptual and easy to memorize notes. I have compiled it in 3 volumes. First volume, you get repertory, organon, materia medica, and pharmacy. Second volume, physiology, pathology, PM, and surgery. And third volume, anatomy, OBG, FM, and SPM. Okay, so I have just compiled it in a very short form only, conceptual and easy to memorize notes. I have given that title because I have referred many question papers, and I make a short note on myself and compiled point by point, just the briefly, not an elaborate section. If you want to do a quick revision purpose, I can suggest you this book. I tell you how many pages it have. Okay, the first volume is having 292 pages. Second volume is having 530 pages. I have given the images also. Okay, when you study from the image, it will be easy to know that will be in your memory. That gives a long-lasting impression in the memory. So I have included maximum diagrams, and also in anatomy section also I have given. You see, anatomy you have to study with the diagram, otherwise you can't learn it. So anatomy also I have included the diagrams. Okay, so the first volume consists of 292 pages, second volume 530 pages, third volume 254 pages it is. Okay, so if anybody want to purchase it, you can contact. Okay, but don't buy all the books. You know, you get confused if you have all the books. So choose from here on which is best. You just do a research and you can buy one. Okay. And I'm telling you once again, this is just for your revision purpose only. Well, okay. Otherwise, I think I can suggest you Success by V. Ram Gopal and ROMS. That is what I have followed. And I think when I communicated with the toppers, they have purchased this New Heights 2 volumes. And also most of the students have Modit Kanna. That is exclusively for that particular subject, for practice of medicine. Okay. And just go check the PDF also. I think Practice of Medicine by Modit Kanna, you get the PDF. And also Jana Rath, you get the PDF. Other AAA also you get the PDF. You check in Instagram. Kaizen, I don't know about Kaizen, Turning Point, and all. VK Chauhan, you will get the PDF. PDF is available. Okay. Okay, now the mistakes to be avoided by any aspirant. First of all, see, most of the students think that materia medica, oh, materia medica, some remedies are there and I'll learn it or I'll learn it after learning the main subject. Don't do that. It is a complete mistake from your part. Don't think that you can learn materia medica last. From day one, you start reading materia medica and the rubrics. Don't think that you can study the rubrics. It is very difficult because you have to remember the rubrics from 3 different repertories, right? So start learning the materia medica and the rubrics from the day one of your preparation. Spend time for that. When you make your timetable, just give time for, yeah, I'll learn 2 or 3 remedies today, or I'll make the study the so and so rubrics from the mind chapter. I will cover the mind chapter within 3 days or 5 days. So such schedule should be there in your timetable. Don't waste your time by studying the whole textbook. See, in the UG or when you are appearing for a university exam, you can read the textbook because you have to elaborate it. Definitely, you have to read the textbook. But when you are preparing for a competitive exam, don't try to read that whole textbook. You can't do it. You cannot learn the 3 volumes of the anatomy. You can't. It is impossible to read the practice of medicine or the text, or it is not possible to read the OBG, the whole text and all. So don't waste your time by studying the whole textbook. You should have a reference. Okay, you should have a reference guide always and learn from that only. Then frequent revisions are necessary, otherwise you will get confused with the options. So this is what I was trying to tell you from the beginning. Revision is very, very important. Most of the students say that, yeah, I have read it 2 times, but I'm not able to. I got confused when I see the options. But why such confusions come? Because you're not thorough with the topic. When you're thorough with the topic, you will not get confused with the options. You can pick the right option from your question paper. Then don't give undue importance to the subjects like FMT and SPM because of very less number of questions. I'm not saying SPM because SPM, I think in the last PG entrance exam, 9 questions were asked. But FMT mostly less than 5 questions only will be asked. Okay, so understand that question pattern and give importance only as such. Okay. Then try not to mug up the MCQ. You should have the basic idea regarding each subject. See, when you practice question papers, don't try to by heart the MCQs. Don't just by heart. Yeah, this answer is for this question. Don't do that. Understand the concept. When you are practicing the question paper, if you are practicing a question, you don't know that question and its answer, you refer and write down a note. You take the printout of the question paper. That is the best option you can do. You take the printout of the question paper. When you practice it, if you don't know the answer, write the explanation of that. Refer the text and write the explanation of that. Okay, don't do this at the end of the examination. When the exam is in the borderline, you will not be able to do it. Try to, when you start earlier and try doing that process. Then later you can do your revisions easily when you go through this question papers. Then how to avoid negatives? That is, in the multiple choice questions, most of the exams, the competitive exams will be having the negative. When your answer goes wrong, you will get 1 negative mark, right? So how to avoid negative? I'll tell you. See, what you have to do is, if you have 100 questions, then what you have to do is, first of all, attempt the easy questions. In the first round, attempt those questions which are 100% sure for you. So don't think that I will do number 1, then number 2. Don't spend time. If you don't know the second question, skip it and go to the next question. If you don't know the third question, it's okay. Go to the fourth question. Don't sit with question number 2. Don't sit with question number 3. In the first round, go through all the questions. And if you're 100% sure, then you can mark the answer. That in the first round, that's the thing you have to do. Read carefully the question, because be cautious of the word except. You can see the question, no? All of the following belong to the mind chapter of Ken repertory except. Sometimes there will be one rubric from the BBCR repertory. Okay, so except, or which of the following is not belonging to the Solanaceae family? See, that word except, the word not, Focus on that and then only answer. Read all the options. Don't jump into the answer immediately. Select the most appropriate answer. You can see nowadays you can see that many statements will be given and they will be asking which of the following is true or which of the following is false. Only A, only B, or both A and B, or all the above are false. Such confusing questions will be there. So read it 2 times or 3 times, then make sure and then only mark your answer. And see, in such cases, A and B only, A only, B only, in such cases, we need special attention for the option. So spend more time for that type of question. Then avoid wild guesses. You can do guesses. You have to take risk while doing MCQ, but don't take wild guesses. That means if you don't know that particular, if you are reading a question and you have no idea regarding that topic, you have no idea regarding that question, skip that question. Just skip it. Don't try to do any type of guesses. And out of the 4 options, like if you are having a doubt with only 2 options, you have a confusion whether it is A or B, then I think you can go with you can take a risk. Then keep that question for the second round. Keep it for review and then try to make an intelligent guess. But if you don't know any of the 4 options, if you don't know that question at all, just skip it. But if you have a confusion regarding A or B or C or D, then just make an intelligent guess. Just think about it and try to attempt. Okay. Then about anxiety and excitement, that is very important. Once you get the question, don't be anxious. You should be very calm. That is what I told you in the beginning. Limit the distractions and you have to stay positive and stay calm. Okay, avoid any type of anxiety and excitement. Don't look the student who is sitting in front of you. Oh, she's doing so fast. I'm very slow. And don't compare. Don't try to compare with each other. When you get the question paper, focus only on your question. Focus only on you, your mindset. Don't focus on what the person sitting behind you or the person who is sitting in front of you is doing. Focus on you. You have to focus on yourself, your mindset. Then only you will be able to recover what you have studied. And trust yourself. For any exams, what you need is a confidence in yourself. Don't say that like, oh, I'm not able to do it. I'm not that intelligent. Don't put yourself into a dustbin. See, many students do that. I don't have that much, knowledge, or I don't have that much confidence. She studies well, she scores well. Stop doing all type of comparisons. You trust yourself because it is your future. Nobody will come and tell you, yeah, you come up, you are able to do it. No, because each and everyone is selfish in themselves. Try to understand that. If you want to come out with a good result, you have to motivate yourself. Nobody will come and motivate you in the present society, because in the present society, I think most of them are selfish. uh, they have a definite goal, or they don't tell you what they are preparing, or they don't tell you they won't come and tell you what all textbooks they have. There are students like that, of course, but I don't say that you should be selfish, but you should have an open mind. But there are some things, what I should say, there are some you should have your own strategy. You should have your own strategy. That is the point. Your strategy will not be the other ones. You have to understand yourself, what is your strength and what is your weakness. You only know that. Okay, so don't depend on others. Don't go and say someone that please motivate me, please motivate me. Don't do that. You trust yourself and understand your strength and weakness, and you develop your own strategy. Don't follow the strategies of others. Don't follow others. Okay, you can get inspired by others. You can get inspired definitely, but you have to follow your own strategy. Some students may be weak in one subject, but you may be good in that one. Okay, and if some student is focusing more on repertory, it means she or he is not able to memorize that much. So you don't go and keep on or keep that subject with you and spend more time. Sometimes you may be good in repertory. Understand your strength and your weakness, and then you should move on with that only. Okay, don't compare with others. That is the best advice I can give you in this last moment. Okay. Then, okay, so that's all about it. It's work hard in silence and let success make the noise. Yes, you should be secretive sometimes. Only after attaining a success, others should know about that. Only once, the flowers, we don't know only when they bloom, we know the beauty of that, or we enjoy the beauty of that flowers, once it blooms, it gives a lot of fragrance. It makes us, it is very beautiful to the nature. It's beautiful to our eyes. So we should be like a flower. Only once we bloom, the others should know that. So work hard in silence and try to motivate yours. Okay, so that's it. So if you have any doubts regarding your preparation, you can contact me. I have given my number. You can just message me, but I'll be replying you not very sooner, but when I'm free, I'll definitely reply you. And if you need any of my books also, you can just message me. Okay, thank you, and all the best.
I thank you, Dr. Aparna, on behalf of all of us for giving valuable time and sharing the very useful tips with us. And thank you very much, ma'am, for everything that you have shared to us. Have a good night. Have a great day. Join with us for more valuable and this productive webinars. So details are already provided. So don't miss this opportunity to get this knowledgeable things like knowledge of how to crack the exam, how to maintain your lifestyle during the exams. So keep following us. Thank you. Thank you on behalf of everyone. Have a good night.
Thank you. Thank you, all of you. Thank you.
Thank you, ma'am. Thank you so much for the wonderful session. And we'll be right back with the one more session tomorrow. So by Dr. We'll have the session tomorrow. Thank you all. Thank you so much. We'll have the session of Dr. Pooja Dubey ma'am tomorrow. So we'll be right back tomorrow with the session. So thank you all. Thank you so much. Thank you, ma'am, for the in detail explanation.
Yeah, yes.
Thank
Before
you all
leaving,
the
let me. I have a request.
Yes, ma'am.
Yes, any one of the participants, can you please give a feedback? I just want to know how the session was helpful to them.
Yes, ma'am. Sure,
Any
ma'am.
students? Yeah, anyone.
Good evening, ma'am.
Yeah, good evening.
Ma'am, it was really a wonderful insight as to how to, approach, what you say, exams and all. As you said, it sometimes, takes away the calmness. You get anxious, and sometimes you need a little bit of, as you said, you should motivate yourselves. But I think at times you need some sort of a very little validation that you are on the right track. So I guess compiling all those previous year question papers, sharing with us the high yield topics, it definitely helped us, and I hope that we can at least do some justice to our talent as well. So ma'am, thank you very much for your time and your selfless efforts, ma'am. Thank you.
Thank you. Okay, all the best for all the students. Thank you.
Thank you, ma'am.
Thank you.
Thank you, ma'am.